Yeah, I think that's it.
You're gonna give away a minute 14.
Oh, that much time? Okay, never mind.
Yeah.
Okay. Well, I was thinking you mentioned that money won't be saved by focusing on the inefficiencies and the regulation within that.
What is your question?
So, I just want to know like what you meant by that, like, because you said like money would be put towards patients, or should be put towards patients rather than actual regulation, like I mentioned earlier. But I was confused on what you meant by that, because again, we aren't focusing on
Right.
patients directly. It's also the patients is only part of it.
Right.
And money is only part of it as well.
And as I mentioned in my Sullivan source, money has been, there's been money being saved with the ACA,
Oh, yeah.
which is an actual service
Yeah.
to Americans. And I mentioned also that there's a program that was under the Obamacare that under the Obamacare that actually, again, it was proved to save money for Americans.
Okay.
Okay, you wanna use your prep time now, Chris?
Oh, yes, please.
Okay.
Thank you.
How are we doing on flowing?
What does yours look like? Okay.
So I didn't have anything on the off case. It was all on the case.
Dang it. I scribbled off the on case and then put it on off case. Come on. Why would we thought that?
Yeah, I didn't. I went safe. I stayed here. Yeah. Angela's looks pretty close to mine. Yeah. David's is pretty close to it.
Well, I scribbled out.
Until you screwed it up. Just a minute of your
So,
prep time.
is it only off case if they say it's like distinctly a disadvantage or?
Or a county plan.
Okay.
I ended up flowing your arguments off case because I wasn't, you said off case, but then I wasn't sure where they went.
Yeah.
So sometimes you just do that because you have to write it down.
Mhm.
You have to respond to it. So sometimes if you don't know where to put it, it's easier to put it on the off case because then you don't think it's actually clashing with something on the case. Yeah. 2 minutes used?
Okay.
Okay.
Okay, so once again, I would like to state what we're talking about again. So it's just how the inefficiencies in the hospital systems are not working out very well, and they're leading to just costs within the medical system. And the plan I provided was to it would change the work style with more focus on the patient's needs and their health in past, present, and future hospital visits. And this included changing the way healthcare practitioners did their practice, and the inefficiencies, fixing this would be in both the hospitals and then how the physicians were working. So also once again, I'd like to clarify that that the medical system in the United States has wastes over $700 billion a year. So every 30 cents, every dollar that you give in, they're wasting about 50 cents. So think about that. And then the first one I'd like to go back to how the actual, in the health systems, how these high healthcare expenditures are leading to much loss in profit. And as my opposition, he clearly expressed that Obamacare is fixing these, but I've proved otherwise in that with the system that's in place, we're still losing money, and there's no doubt about that. Like I said, over 700 billion a year, and the system is the Obamacare is something different than what I was addressing also, because I was focusing on changing the way physicians work, and also like the way they're distributing like their care, and which will help patients save. And I'm not just focusing on like insurance or anything like that. And then like back to the providers being paid for quality, not quantity, which is right now. So healthcare practitioners, they can issue a certain number of procedures or tests that may be done for patients, and a lot of times those are not needed. And part of this in reducing the inefficiencies is taking away those, because oftentimes these are very relevant and they're not needed. And taking away these ones that are not needed will save money for both the hospital system, the government, and the patient. And then to fix that, it's switching to the quantity over quality, where in this case, the providers will reap the benefits. If they're focusing more on the quality of their work, this will help gain, the patients will be happier with the treatment they're receiving, and the healthcare practitioners can be encouraged through rewards to do this. This is their incentive to do so. So, and the U.S. can achieve a higher value healthcare system in doing this, which again creates more efficiency. And these new system with quality over quantity is better able to meet the patient's needs and desires, and it helps effectively reimburse them for the care that they're receiving. Because a lot of times care these days is very overpriced and most things are not needed. And then I'd also like to add that oh yeah, so when patients are paying, my opposition said that Obamacare is already helping with this. Well, if it was helping with this, then why are people still worried about this? I mean, this system is to help the patients in the past, present, and future, and obviously if people are still worried about this, then it has been working. And once again, Obamacare is focused on insurance, and a lot of times it has increased insurance. I'll give Obamacare that, but that's not what we're focusing on here. It's on Obamacare. It's just to create, reduce the inefficiencies in the hospital system. And next thing, with patients saving with this individual system, they'll be able to save individually, because once again they're paying for their quality over the quantity. So if they're putting in more money for a certain procedure rather than having multiple over time, because once again I stated that healthcare practitioner has an incentive to do the same thing, quality over quantity. So if they're putting more into this one procedure rather than say 10 over the course of time, then the patients are saving money as well. And then actually focusing on insurance now, insurance companies like this as well, because they're saving money too. They don't have to spend as much money on patients over time for 10 procedures. And then this new legislation that I have addressed will promote preventive care. So like I said, with this one procedure that can stop, say, like a certain disease, then you won't have to come back and keep having expensive health care or expensive care.
Okay. Eduardo, do you want to use the rest of your prep time?
Yeah, why not?
Okay, and remember to follow the 3 things that I said before that should be in the rebuttals. Why you win, why you're don't lose, so maybe your opponent's major argument, and then how even if, the third point is even if your opponent's right, why you should still win the debate. Okay, starting your prep time now. How are we doing on the filming?
Dude,
Okay.
Oh, there wasn't one on here?
No, there was none on the off days.
Oh,
no, it's okay.
I thought the insurance company mark would be on there. No? Oh,
That's still an advantage, right?
Yeah. Yeah.
okay.
They have to specifically label it as a disadvantage or a counterclaim for it to go on the off case.
Oh,
Okay.
Yeah.
I'll do that then.
So I didn't know that either. I didn't know that.
What does your schedule look like Wednesday? I want to meet with you.
I have a clarifying question.
You have a 1 minute, yeah.
Yeah, I know we can't bring up like previous points, but
Well,
you can still use the evidence.
Yeah, you can-
Based
you-
off of,
Yeah.
okay.
You can bring up previous points. You can't bring up new points.
Yeah.
I'm talking about, new evidence.
Oh, you shouldn't bring up new
Okay,
evidence. no.
shouldn't.
I'm done with class at 11:35. So I'm done like in this room and then I can just catch the bus and head over.
30 seconds remaining. Beep, beep, beep. It didn't beep for some reason. You ready, Eduardo?
Yeah, I'm ready.
Okay.
Okay, I want to first address my opponent said regarding efficiency in hospitals. I just want to reiterate that that with the Affordable Care Act, what I'm trying to prove is that that people aren't, that there's some Americans that aren't insured in the first place, and there's programs like the Affordable Care Act provide that insurance to individuals. Efficiency in hospitals and other facilities is, I'm not saying we should disregard it, but it's not in our priority right now because there's people out there that don't even have insurance to go to these facilities in the first place. Just proven on that point. And as we can see from the evidence I've used before, that is proven to increase the number of individuals who have been insured, and is proven to also increase money being saved from programs like Obamacare and other pilot programs. Regarding quantity and quality of these services, my opponent mentioned that sometimes we should be having quality care instead of quantity care. Well, with regards with that, sometimes this quality care is needed. I mean, sometimes this quantity care for these individuals are needed, and because the money it's being used to, all the money is being used to pay for these services. It's not, well, I mean, part of it is going for the person who's providing the service, like the doctors, obviously. But majority of this money is used to fund for more research and development. So really, these quality care services is it's not. It's used to to provide, gradually you'll provide quality service with new services. I mean, it's not like you're still using what we used 50 years ago when treating a patient with cancer, so per se. With regards to I also want to mention that with the ACA that this is one program that's that was recently over the years has been passed and is proven to be successful in most of the cases. But again, it's ensuring it's having insurance for those Americans that don't have it. This is one option that majority of Americans can use. And again, efficiency should be I'm not disregarding it, but again, shouldn't be as important as providing actual services and insurance to provide services to these Americans. With the ACA, it provides an incentive for the government organizations and other companies providing services to again, to provide more open options for opportunities for choices for Americans to choose from. And then once Americans are more insured, then we can start talking about how to better these programs in the first place. So, yeah. Time do we have?
2 minutes.
Well, I also want to say that regarding some of these services that are being used, I mentioned before that the doctors are also getting a paycheck. But as I mentioned in my previous article, Field, who was a JD and MD, he would rather spend more time, I should reiterate at that point, healthcare professionals may feel that they spend more time complying with rules that direct the work than actually doing the work itself. Now this is just one person out of many who just feel as passionate what they're doing and providing these services to patients. That you can tell that these people are genuine and they actually want to care for these individuals. So actually providing insurance to those who don't have it, who are uninsured, for example being the ACA, providing that insurance can is just a step, is a first step to getting their basic necessities of healthcare taken care of, and it's also I just want to state that it's a two-way between the people who are making those services and the services to allow for those people to give those services in the first place. So yeah. And again, I just want to reiterate that efficiencies for these facilities should,
Okay. All right, you want to use the rest of your prep time, Chris?
Yeah, how much time do I have?
2 minutes.
Okay, perfect, thank you.
How we do?
So through this is how you notice like what's being addressed and what's not. It's starting to make sense.
Good.
Yeah, I have a bunch of questions afterwards.
That's fine.
What's the specific verbiage of the question for the debate? Just curious.
The United States federal government should adopt a policy to significantly reduce healthcare expenditures. It's on the campus. Yeah. It's on the front page of the campus. 1 minute remaining.
So, once again, I'd like to reiterate that, affirmative for this side is about, that the government structure on healthcare is inadequate right now for most citizens. And, this legislation that I propose, should focus on fixing the inefficiencies in the source of medical care, which is the hospitals and health physicians' work, and this would, could potentially help Americans save money. So, why I think I won this is, I've clearly pointed out, how this, quality over quantity care as, is a better, way to, approach this from the